recover from anesthesia before being discharged to the escort. Post-operative instructions were given verbally as well as a written form. This was a lie. Pinprick to the left tongue with a hypodermic needle elicits no painful response. Hi, my name is Dawn, and I had my wisdom teeth out a few years ago, and I'm going to talk about that. Maybe you're thinking about having your wisdom teeth removed, or you know somebody who's thinking about it, or you know somebody who's had their wisdom teeth removed already, or you're finding this video because you had your wisdom teeth out and you woke up in excruciating pain and you can't get any help. I'm just going to share my side. A lot of my journey has been suck it up, buttercup. I'm sorry to say that, but it's just the truth. I had my wisdom teeth taken out in February of 2019. It is currently May 2021. And I woke up today in a lot of pain. Yesterday was a good day. My pain level was at about a 3. Today it's about a 5. I'm slurring my speech a little bit. I had made another video and I found myself angry and ranting and really angry. So I took a pause and I erased it. According to the Journal of the American Dental Association, nerve injury is a known and accepted risk of many oral surgical and dental procedures. Such injuries may occur despite the practitioners providing the best of care. So you can only imagine if they're not providing the best of care. Taking proactive measures during evaluation and surgery may reduce the incidence of nerve injury. You know, it might, but obviously that wasn't my case. They didn't care. Unfortunately, I really feel like they didn't care. I don't think that they did it on... No, that's me sticking up for them. I also am going to tell you, I am on the autism spectrum, so I kind of see things differently than some people do. Just because he may not have done this on purpose doesn't mean everything he did after that, he wouldn't help me. My facial structure is changing. I have permanent damage from my tongue, burning, numbness. Vanderbilt in Nashville stuck a hypodermic needle in my tongue and validated that I couldn't feel that there was a needle in my tongue. It goes all the way past my throat, all the way to my lung, the nerve damage. They deny it's possible, the people that did it. But this mostly happens to women. If something's happened to you, make a video. Talk about it. Let's get some awareness out there. If you like this video, please thumbs up it. It helps me. If I don't get paid, but well, maybe one day I've been like 50 cents, I don't know, in like 20 years. But if you don't like it, thumbs down me too. It helps. I took the time to do this. Okay, when nerve injuries secondary to dental or oral surgery procedures fail to resolve promptly, the resulting, I can't pronounce this word, dysesthesia is unacceptable to the patient. Timely treatment gives the patient the best chance of favorable outcome. Treatment may involve surgical exploration and repair of the injured nerve. Okay, and usually exploration is about all they can do. Most people that try to get it fixed can't get it fixed. This is an injury that needs to quit happening, and it keeps happening because people don't even think to write a letter to the Board of Dentistry and the medical board and write a letter to their insurance company. These dentists are not going to tell on themselves. If you try getting help from them and they roll their eyes and they look away, that's what happened to me with this surgeon. I'm not allowed to call him out on platform, unfortunately, but I can call out the system. This was from the Journal of American Dental Association. So they admit it. They admit it's common. But they'll say it's uncommon. You'll hear that it's common and it's uncommon. I have paresthesis. I can't pronounce it. I have lingual nerve damage. I have a crushed saliva duct, and I have trigeminal neuralgia in my face, all from having my wisdom teeth removed. Woke up in the most excruciating pain I've ever had in my life. This is from the Georgia Oral and Facial Reconstructive Surgery Institute. I couldn't afford it, $30,000 just for exploratory surgery. No insurance covers it. You think that surgeon that hurt me is going to pay for it? No, he's going to keep all that money he got paid for ruining a part of my life. Now, I decide to be positive and I move on the best I can. Otherwise, I wouldn't even be doing this video. I just recently started playing guitar and trying to sing. I have to relearn how to sing. And because I'm losing the hearing in my left ear now, I'm kind of tone deaf now, but I was a singer. And, you know, my jaw, I feel dents popping up in my jaw on both sides that actually hurt. And I'm getting jowls. So, you know, I want to be in front of a camera, but my facial structure is changing. Granted, it was 2 years ago and I realized we age. But, so this says about nerve repair. Injury to the peripheral sensory branches of the trigeminal nerve. Nerves that are providing the feeling to the face and oral structures are well-known complications. Well-known complications of a variety of oral and maxillofacial surgery procedures, including third molar wisdom tooth removal. That might be something that you just dealt with. And I can't say this. Root canals, dental implant placement, facial trauma, and or other. This happens all the time. People get their wisdom teeth removed. They were never warned. Right before I had surgery, he said, "Oh, you may have a little numbness. That's a permanent thing that could happen. It's so rare. You are healthy." And I went, whoa, wait. I have disc issues and I have fibromyalgia. And he goes, "You'll be fine." I mean, the next thing I knew, I was waking up. That warning was useless. There was nothing I didn't have time to back out. They already had me in the chair. You know what I'm saying? And one of the solutions to take care of yourself in the future is to start taking antidepressants. Why should I have to take antidepressants for the rest of my life after getting my wisdom teeth out that I never had to get out? One of the things I do to help me, if you've ever seen these wacky looking things, oh, it's rose quartz, it'll, whatever. Yeah, I mean, I'm into crystals, but this is what I do. I do this a lot so that I can, it feels good. This one, you go like that. You can put like jojoba oil or something if it feels good. If you have an essential oil that doesn't hurt your skin that you like. Well, I guess if you live in the United States, some countries don't let people have. I do it on both sides. But I have, you know, a lot of pain. This stimulates, like I think I have an infection. I have a reoccurring infection. I had to get, you know, the oral scan where I couldn't move. I have permanent mouth pain and I couldn't move. And they had an infection. And then I went to my primary clinic and they wouldn't give me antibiotics. Even with the thing, they said, "Oh, this is allergies." And they were like, "No, it's from the wisdom tooth damage." It was like a year later, I had an infection still. And it hurts. I mean, I feel like I have a chronic infection right here. It hurts every day. On top of, it feels like a bruise, but it feels good to do this. Every day on top of the numbness and burning and that goes all the way from my tongue, my vocal cord, and it goes to my lung right here. And I a lot of times I start coughing. Sorry, my nose itches. I'll do this one too. Just whatever feels good. And they're cold. Cold rocks feel good. I started using CBD oil. I never relapsed on like drugs or alcohol. I can't take ibuprofen anymore because I use so much ibuprofen that I tore up my stomach. So be careful. I smoke non-narcotic hemp with THC and I use the oils. It doesn't take the pain away. I don't use it every day because it's a few years in and I've learned to manage some of the pain. My pain is never below a 3. I'm sorry to tell you that. My pain's never below a 3. But the CBD stuff helps me deal with the pain. You know, I can't just do the things I used to do. Lemon helps sometimes a little bit. Because one of the things they did is it crushed my saliva duct. So especially at night, my mouth is dry. Oh my gosh. Vanderbilt, they stuck a hypodermic needle in my tongue to validate. And it says with no illicit response. I had to quit teaching. I was a volunteer teacher. I coached a wildlife discipline. And those kids, even though I was in so much pain, I thought I was going to die. It was like a few months after surgery. I had to take hydrocodone. They were making me sick and I had to use CBD. And I'm proud of my sobriety. But one of the problems, too, is being in recovery groups. One of the things that was brought to my attention, I can't really keep coming to sobriety meetings if I'm using CBD. Says the person drinking a highly caffeinated coffee and smoking cigarettes and drinking Coca-Cola, which is still flavored with the non-narcotic coca leaf. But, you know, just culturally, CBD, anything THC is off the table. even though I cannot take any other painkillers. And they have no idea what permanent neuralgia. Anyway, so I couldn't sue. I couldn't sue. They're protected. These bastards are protected. I'm so sorry to tell you this. If you can still try, because you never know who's going to be the person that gets through and is able to bring justice. If you want to try to be a trailblazer, go for it. But just be kind to yourself. It took me over a year just to be able to make my way to Vanderbilt, because my insurance kept saying, no, you need to go back to the person that did it. Are you crazy? They already told me they were done with me and they didn't want to see me anymore. They refused to help me. And if you're female, and it happens mostly to females than males, is what I have figured out over the past few years through support groups. The doctors might tell you things like, it's in your head. They told me it was in my head. They told me it was a psychotic issue. They told me that it was pre-existing. I'm sorry, but before I had my wisdom teeth out, if you stuck a hypodermic needle in my tongue, I probably would have came out of my chair. After, I woke up screaming from surgery. People usually come out of surgery really high and having a good time. I woke up screaming. Even though I woke up screaming. The report says, this is from the institute that removed my wisdom teeth and refused to admit they could have hurt me at all. There was no complications and the patient tolerated the procedure well. I woke up screaming. They were wheeling me out of there. I was barely awake and they were wheeling me out and getting me out of there. She was allowed to adequately recover from anesthesia before being discharged to her escort. That's not true. They had me out of there so fast, especially because I was screaming. Post-operative instructions were given verbally as well as in a written form. There's no way I could have processed any information in that state. I thought they had cut my tongue off. And I kept biting my tongue. I bit my tongue so much. Now I bite my tongue maybe once every 2 months. It's about 2.5 years later. Anyways, regardless, you know, if you have any questions or anything, put it in the comments. Oh, and my other thing is I had joined some support groups on Facebook. I learned, I got helped a little bit. I did my best to give back as much as I could. Unfortunately, there was even trolls on the support groups for Facebook that were like the wives of dentists and stuff like this. When I mentioned this lady, she had something called trigeminal neuralgia because she couldn't figure out what it was. I warned her this is called the suicide disease. This wife of a dentist jumped all over me. She said I was making it up. There's no such thing. Google suicide disease, dental, trigeminal neuralgia. Put those words together and see what you come up with. Don't ever quit advocating for yourself, but don't knock yourself out over it, because there's light at the end of the tunnel. I mean, I don't pay attention to it all the time. I am having a high pain day today. Yesterday was a good day though. I'm learning to sing again. It's not like it was. I'm learning to eat more things. I couldn't eat a hamburger for over a year because I couldn't handle more than one texture at one time. But I'm sorry if this video has bad news. I don't know. Make sure you write a letter to the Board of Dentistry, the medical boards, your insurance. Even if you don't know how to do it, do the best you can. And don't be afraid to tell your story. We need people to get the word out there. Have a blessed day.